and Standard of Nursing Practice by Catherine E. Blackburn. The evolving role of nurses as a profession reflect the need for a guide of our practice. These guidelines shape the responsibility of a nurse to serve the public in their community. According to the American Nurses Association, nursing is defined as the protection, promotion, and optimization of health and abilities, prevention of health, illness and injury, alleviation of suffering through diagnosis and treatment, of human response and advocacy in the care of individuals, families, communities, and populations. Nurses are constantly adapting to their environment. Their scope of practice describes the range of responsibilities that they are educated for, remain competent in, and hold the authority to provide. They support the care plan for their patients and use their reassessment skills to educate them to reach their prescribed outcomes. The basis for the following slides is to discuss the scope of nursing practice, its standards, and how it differs from the Nurses Practice Act, the value to the nurses and patients of being guided by standards, and a quick review of the types and categories of standards of practice per ANA. How nurses are guided in their practice. The nursing scope and standards of practice answer the questions of who, what, where, why, and how of nursing practice. We, as active licensed nurses, are the who. The American Nurses Association's definition of nursing reminds us of what we represent. The care of patients is in multiple environments, such as hospitals, long-term care, hospice, and outpatient clinics. Our obligation to our community is why we are nurses. The qualifications outlined per state is how we practice as nurses. Of course, we are governed by regulatory bodies with a goal to always protect the public. Why standards are of value to nurses. According to Talbot and Winsky, the value of having a defined standard of practice, the how and when of professional standards of conduct are enforced. A structure that holds every licensed nurse to a level of patient care that is detailed defined, directs the baseline of care for every nurse using our framework, the nursing process. Meeting the standards of our practice is expected of all registered nurses, regardless of role, population, or specialty, according to the American Nurses Association. Our continuing education is outlined, evaluating professional growth. Standards of nursing practice as a value to the patients holds value to the patients as well. Masters notes nursing competency plays a large role in ensuring patient safety. It is a way of measuring a nurse's performance. It involves the patient in their care, individualizing interventions, improving outcomes. Basic categories of standards of practice. All nursing standards of practice provide a direction for the nurse that focuses on knowledge, skills, and behavior. The goal is to provide care in the safest way possible. There are standards of care, professional performance, practice, and a code of ethics. The Nurse Practice Act differs from the ANA scope and standards of practice. It is the legal scope of nursing. Developed by the NCSBN, it is a state-by-state regulated. According to Dolan, nurses are required to provide patient-centered care. This requirement is defined in a broad definition of the roles and responsibilities of all registered professional nurses. In conclusion, the scope and standard of nursing practice guides nurses in their daily patient interventions. They hold a value to patients and nurses, and they are separated in categories of care and performance along with a code of ethics.